Hello. How is everybody? I'm Michelle, and it's good to have you here. I know I apologize for it taking a couple of weeks for me to get my videos up, but if you guys follow me over on Instagram, you were able to see that I was in the hospital in January after a second pulmonary embolism, and let me tell you, that has been a setback that I wasn't expecting. I look and feel amazing. I'm sitting here in jeans that are 2 sizes too big again. I'm gonna have to go buy new jeans again, which is great. And that's what I had this surgery for. That's why I have been working. I am 8 pounds away from Wonderland. And if you're new to this community of weight loss surgery, Wonderland is when you get your weight down under 200 pounds. So you're in the 100 category. I can tell you the last time that I was at my goal weight, 175 pounds, was when I met my ex-husband in 1993. So that tells you how long I have been struggling with my weight. It's been a long time, and I did mention on Instagram, you're gonna see Bear back there and Stella probably walking around, the cats. I've mentioned in the past that we're gonna have setbacks during this process, and nobody's journey is the same. Non-scale victories have been huge for me, and being only 8 pounds away from Wonderland is a huge accomplishment, because in March of this past year, not even a year ago, I was 285 pounds, and I was the highest weight that I have ever been in my adult life in March. Now, that was exacerbated. I have multiple sclerosis, and I'm having a hard time talking today. I feel like I'm running 100 miles an hour. I have MS. I was diagnosed with MS officially in 2015, but I've known for many, many years that I was predisposed to getting it after losing my vision in one eye, losing my hearing in one ear, over 20 years ago. So it's been coming. Taking steroids during these hearing losses and vision losses, and during my MS flares, because I have relapsing recurrent multiple sclerosis and not progressive. Progressive is very fast moving, and progressive MS is very debilitating. I've mentioned Selma Blair on here many times. She's the celebrity face of multiple sclerosis, and she has gone downhill, sadly, very fast, and she's much younger than me. I turned 51 January 31st, so I'm so sarcastic today. I'm so sorry. It's really hard for me to admit out loud that I'm not just 50 now, but I'm 51. I don't know why this is so much more difficult, but it's been challenging for me. I have a lot of things that just get under my skin, and aging is one of them. So I try to take care of my face, but what I wasn't doing, that you guys know that have been following me, and anybody new that's come in here, thank you. Please subscribe below, turn your notifications on. You'll see when the next video comes. I was exceptional at not taking care of myself. I have always been a caregiver. I'm an RN, and I have worked in healthcare for over 25 years. And anytime my friends have needed me, or anyone has needed my medical assistance or my help, I'm one of the first people that's gonna offer assistance and to help. And that's just in my nature. But what I wasn't doing is I wasn't giving myself that same courtesy and that same lifeline to say, hey, you need help. And we're gonna talk about mental health today, because I have a friend that inspired that in me today. You need help, and you need to get your health under control, because your kids are 21 and 16. And if you keep along these paths of diabetes and heart conditions and valve problems and high blood pressure, I'm not going to be around for my grandkids if I didn't get this under control. So I've gone from 285 pounds in March to 208 pounds this week. That is a huge accomplishment. And it's about 60 something pounds since surgery. But I'm not just counting surgery weight, I'm counting my highest weight because it was only 5 months before I had my surgery. So I do include that in the numbers because it's easier for me to calculate from where I was versus where I am today, because it's a much bigger accomplishment as far as I'm concerned. I lose very slowly, and I've had to come to accept this. I am 5 months into this journey, 5 months last week, post VSG. And I can tell you this 5 months has just been a roller coaster. It has been up and down. The scale deflates me so much. I have been a huge proponent of non-scale victories throughout this whole process because I have a hate relationship with the scale. And it comes from years and years of yo-yo dieting back and forth and trying to figure out how I managed to gain all the 30 pounds back that I did on the big fad diet, or drinking the weight loss coffee, or taking, the weight loss pills, or prescription weight loss pills. I had tried it all. Weight Watchers, Slim Fast. I tried it all, and I would lose, and then I would rebound right back where I was. So this has been a really scary time for me, and it's been really challenging because I'm having to unlearn, as you guys are, probably 35 or 40 years of really bad eating habits. My family loved to eat. I still have my mom and dad and my brother. My whole family has been supportive of this surgery. My kids have been supportive. My closest friends and have been supportive of me doing this to get my health under control. And I can tell you, within 6 weeks of my surgery, I had normal blood pressure for the first time in 15 years. I have had a normal blood pressure reading at every single doctor's appointment that I have been to 6 weeks post-op. So I no longer have to take blood pressure medication. I was pre-diabetic and was actually taking insulin. Nobody knew that. We were trying to prevent it to see if it would make a difference in my A1C levels. I was right on the cusp of diabetes at 285 pounds. Worst blood work I've ever had come back in my life. My vitamin D was low. My vitamin B was low. And when those nutrients in your body get low, you get depressed. It's clinically proven. Vitamin D, that's why there is SAD, or seasonal affective disorder. A lot of people that live in the north have what are called SAD lamps. If you guys haven't ever heard of them, they are actually a lamp that you can place on your desk. Looks kind of like similar to a makeup mirror, how you would open it up with the lights. And it's light therapy for vitamin D, because people that live in Seattle or even Detroit, as an example with me living there, 8 months out of the year, it's dark. It's snowing, it's gloomy, it's rainy. Seasonal affective disorder is part of depression, and it's a very real thing up north. And those lamps are available for anybody that's struggling. I work from home. I'm trapped in here all day long. I happen to have a break so I could do this video for you guys today. But vitamin D and all your vitamin Bs are very, very important for your mental health. And that's where I'm going to go next, because I have struggled with severe, debilitating depression and anxiety since I was 8 years old. That is when I remember going to my first therapy appointment. My parents were sending me to this therapist, and I did that all throughout my teenage years too. I had an eating disorder, which adds a whole new dynamic to this. My parents have mental illness issues in our family, primarily on my mom's side of the family. Grandfather, I'm not going to name everybody in my family but that has mental illness, but just know it's been passed down to me. And I live with fear every day for both of my kids because I know what I went through. I'm always the person on the outside that looks pulled together and laughing and joking and smiling. And frankly, that's freaking exhausting. It's exhausting to look like I have my shit together, because a lot of the times I don't. Without medication, I wouldn't be okay. I don't know that I would be here. without medication, honestly. That's the level of struggle that I've had over the years. And not really any of that attached to my weight. This is a chemical imbalance in my brain. And we don't know if this depression and anxiety, bipolar, whatever this was that has manifested itself in my brain is related to multiple sclerosis or not. We have no idea. So I don't know if my wires aren't firing right because I'm mentally ill, which is still a stigma in the United States and in Canada. It's still a stigma all over the world. People that suffer from depression suffer alone. And I did that for a long time until I was able to speak my truth. 2012 was my rock bottom. That was it for me. That was a live or die situation. And luckily I was able to pull through with the help of medication and with the help of treatment. And at the end of this video, you're going to have the suicide hotline and you're going to have the suicide text number, because I know what it feels like to be in that place, and I haven't been there in a long time. And I owe that to my doctors and to my medication. But I know what that feels like, to feel like everyone in your life would be better off if you're not there, if you're not part of it. Suicide's called very selfish. And I can tell you that most suicidal people would flip that around and would probably tell you that they thought they were doing the people in their lives a favor by not being in it anymore. Sorry. I haven't talked about this in a long time. And I have a friend that inspired me to talk about it today, because mental illness is not a joke. This happy, outgoing, successful woman struggles so much on the inside, even with medication. And I keep it together. Man, I keep my shit together as much as I can for my kids and for my family, my friends. I have to add myself into that because I am keeping my shit together for myself. And trying not to be so hard on myself with this weight loss. You're supposed to mentally be prepared to go into this surgery. And part of the reason why your insurance company, I'll tell you this, wants you to go through psychological exam is they want to make sure that you're in a place where you can manage this, because this is hard. The easy way out pisses me off. It makes me furious when people say that. Why can't you just go to the gym? Have depression and anxiety and be 100+ pounds overweight. Do you want to go to a gym and work out? Probably not. I didn't. There are people out there that do, and props to them. Props to them if they can scrape themselves up out of bed or scrape themselves off the couch to go to the gym and lose the weight the natural way. Awesome. That's great. If they've struggled with depression and they're able to do that, I can promise you that it's under control in some way, shape, or form, because that's not how depression and anxiety presents. It's not a, hey, I want to get up and go run and do everything. Half the time that I agree to events and things, I am thinking in the back of my mind, I need to make sure that I am mentally prepared to go to this activity and do this and be there 100% for my kids, for my family, for my friends, for work, for the people that depend on me every day to show up. And this is where I get angry, because I didn't show up for myself. It makes me angry that I wasn't important enough to myself to show up until I got the treatment that I needed and until I've had this surgery to get my health under control. I have more issues. I have more issues that I need to deal with, and I know it. But I can only take certain things at a time. The thing that stuck with me the most when I got help in 2012 and 2013 was a whole journey where I wasn't well. I left the state and I moved away for almost 2 years to get my shit together because it had to be a change of scenery or I was going to continue to have the toxic people around me. And it's not their fault. I'm not blaming anyone. It was my fault. Absolutely my fault. But I had to physically remove myself from the situation to focus on me and get well and be a better mom for my kids and a better daughter and a better friend. And people didn't understand that journey, and they don't have to. It's not their journey to understand. This is my life. This is my weight loss journey. It's not going to be like anyone else's. I'm going to use my tool the way that I feel is necessary for me to get through the day. I'm going to do that because I have to put MS, kids, I have to put my mental health, my anxiety, my work responsibilities, my family, my friends, all of that up here. First and foremost, with myself number one on that list. Until you do that, until you put yourself first, you're going to stay in that hole. The thing that resonated with me most when I was there in 2012 was, and this sounds very cliche, but I'm going to tell you, this was the bell. This was when the bell went off for me. The light bulb went off for me while I was there. On an airplane, they instruct you before takeoff that if there's a situation in the air and the oxygen masks fall from the sky, that you as a parent, an adult, are to put your mask on first and then take care of your kids. And we sit there as parents and we go, wait. I would rather not have the oxygen. I want to give it all to my kids. I want them to be okay. That's not how this works. Your spouse, your kids, your friends, your family, they cannot come before you anymore. You have to put yourself in a place where you know that you're deserving and you're worthy to take care of yourself. You've got to put that mask on yourself first before you can help anybody else, your kids, your family, anyone that needs you. You have to put that oxygen mask on yourself to show up for yourself and to put your health and safety and well-being first. And when you do that, doors open, light bulbs go off. I am not anywhere where I was in 2012. I'm successful. That was, like I said, it was rock bottom for me. I try to do the right thing as much as I can, and I struggle. I struggle with other things every day. I am not perfect, and like I said, I can only take on one thing at a time. Right now, it's my weight and my health. That's what I'm taking on. But what I do know is that I believe in myself now, and I never did until 8 years ago. Outwardly, it looked like I did, but on the inside, it didn't. It didn't match what I was showing on the outside. People that truly knew me knew I wasn't okay. They knew something was terribly wrong with me. Because I show my true self to very, very few individuals. And I've made a decision in the past several years, since 2012, to cut toxicity out of my life. If you are not supportive of my journey and what I'm going through, bye. Bye. And I've had to say that to a lot of people that I loved and I cared about. But when you don't put yourself first and you allow people to take advantage of you and you show up for them, but they don't show up for you, that's the time to cut the cord. And that's the time to make your circle small. This journey alone without depression and anxiety is hard. And you add additional things on top of it. And I'm just lucky to be sitting here today talking to you guys about this surgery and saying I was 285 pounds less than a year ago. I'm 208 right now, and I will get to Wonderland. Might take me another 2 months. I don't know how long it's going to take because I'm not putting a time frame on this. I have a goal weight in mind, but I didn't say in 1 year I'm going to be 175 pounds. Since 1993, like I said, I haven't been 175 pounds. So I have to be realistic about how quickly this weight comes off, how big I was when I started the journey. I have to take all of that into consideration, and my mental health and controlling my MS and everything else that goes along with my body and my function. Now another pulmonary embolism. So I'm back on blood thinners. I start on Coumadin again Thursday because the Eliquis that I'm taking is making me feel horrible. So I've got to get blood work every single week until I get my INR under control. I'm going to have to miss work. But it's a process to keep myself healthy. And I can't put my job or my kids or my family or my friends before my health anymore. Some people might call this selfish. Hey, we had weight loss surgery and we did this the quick way. Let me tell you something. Be thrown into having to change 35 years of eating habits and see how well you do. The reason for that psychological is to make sure that mentally you are solid before you go on this journey, because it is freaking hard. It's hard. That's it. That's my truth for right now. I appreciate this forum. I really do. It's been really hard. I've been struggling with work and kids and being sick and my mom being sick. I've been struggling. It has been a hard year and a half. But I'm grateful. And I believe in myself. I believe in you guys. We're going to struggle. We're also going to be successful. We're also going to be sitting here, hopefully for you, like me, in jeans that are already 2 sizes too big again. I don't like to shop. Kind of an anomaly. I love purses, but I don't like to go shopping. It's not my idea of fun. But having to go buy new jeans and everything, I've made suggestions to you guys not to do that until you know that you're going to stop losing weight, because this is a perfect example. I have gone through, I was a size 22 in March of last year. These are 14s and they're too big. I don't even know if I'm in a 12 right now. I'll have to go check and see, but I'm not going to give up a lot of these jeans because I can wear belts now, y'all. Belts. I actually have a collarbone showing. Like, it's starting to stick out again. That's going to be my favorite non-scale victory, when I actually get those beautiful collarbones back that I used to have when I was thin. So that I haven't had in so long. It's the small things, but wearing a belt for the first time in years, that was a huge victory for me. So these baggy jeans can be held up with a belt, as far as I'm concerned. Because I can't go buy size 12 jeans and then lose another 10 pounds or 15 pounds at the size I am now. That makes a huge difference in my lower body, and go buy 12s and need 10s after that. It's a process, and I'm not complaining. Trust me, I'm not complaining. Wearing a belt and wearing a size 14 pair of jeans right now was like a life goal for the last 10 years, and I'm doing it. I'm achieving that goal. I did it with surgery. You can like it or you can't. It's fine. I know I'm solid. I'm going to be good. I'm going to put myself first, and I'm going to take care of myself first, which then allows me to take care of everybody that I love and that I care about. And that's a hard job by itself. I know this was a long video, but the inspiration that came from my friend this morning that is struggling, letting people know in these forums that they're not alone, is so important. And when you subscribe, turn your notifications on, I post a new video, you'll get notified. But I'm going to put the hotline and the text line information at the end of this video, because I know what it's like to struggle. I know what it's like to look okay on the outside and not be okay on the inside. And let me tell you, the biggest compliment that I have ever been given in my entire life came a couple of years ago from someone that knew me, not inside my social circle, but had seen everything that I'd gone through, and the hospitalizations and the pneumonia and the lung problems and the pulmonary embolisms and all that. And they said, you know, you're really brave. And I know I only see what goes on the outside, but you get knocked down in front of everyone and you let people know that you're knocked down, and every time you get back up. What an incredible compliment to give someone like me. I don't want to hear you're pretty. I don't want to hear you're strong. You're accomplished. I don't want to hear any of that. Someone on the outside of my circle telling me that I appeared brave was the biggest compliment I've ever received in my life. And I hope, if anything, I have taught both of my kids that if their mom gets knocked down, I'm not going to be down there for long, that they're going to see me get back up again. I've been blessed with two of the best kids ever. And as any mom does, I worry about them both all the time. But I wanted to show them I could be the mom I am today. I owed that to them. And I owed it to myself to get my shit together. And I did. And I'm still not 100% together. As you guys can see, this is a hard conversation for me to have with myself, much less people. I hope this helps someone. I hope it does. Take care of yourself. Take care of your mental health. Put yourself first. I'm giving you permission to do that. You got to give yourself permission to put yourself first. And you'll be okay. I promise. I'll catch up with you guys again soon.